Good evening. It's a lovely Sunday, and then we are back again. We are live on ATV. This is Fact of Health. I'm Na Edu. Today we are discussing asthma. You can always follow us on all our social media handles: Facebook Fact of Health, Instagram facts.of.health, Twitter at Facts of Health 1, and then subscribe to our YouTube channel Facts of Health, and then you get all previous episodes there. I'm with Dr. Alan Dazi from the Kolebu Teaching Hospital. He's a family physician specialized in asthma. So he's from the family medicine department in Kolebu. Today we are discussing asthma. Stay tuned. We'll be right back. If you just joined us, this is Facts of Health. We are live on ATV. We are streaming live on Facebook. You can search ATV Ghana or search Facts of Health, and then you get to watch I and Dr. Alan Dazi. Today we are discussing asthma. I'm Na Edu. Thanks so much for joining us, Dr. Alan. You're welcome to the show.
Thank you very much for having me.
Yes, you're looking good. I like your white shirt and your tie.
Thank you.
It fits you.
Thank you. You're looking very good too.
Thank you. Thank you so much. So,
great.
You are a specialist from the asthma clinic, family medicine department.
Yes, so I'm a family physician and I run the asthma clinic at the family medicine department at Kolebu Teaching Hospital.
Oh,
yes.
Okay. So, family medicine, is it totally different from the normal doctor?
Yes, so family medicine is quite different. It's a specialty on its own.
Okay.
And basically, a family physician is a specialist who sees everybody, irrespective of age or gender, and with all manner of diseases.
With all manner of diseases?
All manner of diseases. So we see people first, and then we treat most of them. But those that we think need other specialists, we send them on.
Oh, okay. So
yes.
Which means you deal with the family, because family. It means
no,
you deal with the family.
The term family is contextual.
Okay.
In the sense that we have an approach to treating diseases, which we describe as comprehensive care, and it is best situated within the context of the family.
Okay.
Because an individual has to do with the family more. The family defines an individual's context better than anything else. So the term family that goes with the specialty does not necessarily mean we are limited to seeing the family, but we have a holistic approach to treating diseases that is best contextualized within the family.
Oh, okay. So yes. I get it. We have been refreshed by Joan Diva and Baker's Hub. You can follow her on Instagram, bakers_hub.gh, and then Facebook, Baker's Hub. And you can also get Joan Diva. Joan Diva's ad will play, so you can get her numbers there. Doc, we are discussing asthma today.
It's my passion.
It's your passion, then?
Yes.
It's my passion too, because I have a lot of people who have asthma that I know.
I think everybody does.
Everybody does, eh?
Almost everybody knows one person or the other who has asthma. I know several people.
Oh, yeah. Oh. Yes. So it's part of us.
It's very much a part of us.
Is the statistics very high?
Yes, very high. So in Ghana, even though we don't have very robust statistics, there's, reliable data that shows that in Africa, the prevalence from country to country is from 10 to 20%. Wow. So that means that we are looking at least 10% of Ghanaians having asthma. So is that huge?
Is that huge?
Yes. And unfortunately, it's one disease that affects everybody, irrespective of age. So children, adults, the elderly. So it's quite a huge population.
Yeah. You know, the olden times, they used to say, Sikafoyari. I don't know if you've heard that term. Sikafoyari.
I bet Danny here for Soyari. Everybody gets asthma. Yeah. So it doesn't respect your pocket.
It doesn't respect your pocket.
You may have money or not. Asthma doesn't quite respect that.
But what's asthma?
So basically, asthma is a chronic disease of the airway. when we say chronic, you know, there are some diseases that are hit and run. They attack you and they go away. But there are some diseases that stick with you and it's almost lifelong once you get them. So asthma is that kind of disease that when it comes, it's with you.
And then
that's why that's it. So you have it, and it affects specifically the part of our bodies that we call the airway. The airway is simply a tube that starts from our throat, goes down into our chest, through which we breathe in and out. So, you know, this tube that takes air into our chest and brings it out, you can imagine that is so important. So a disease that affects this part of the body, you can imagine, is quite a terrible disease.
It's quite terrible. But are there any types or any? Yes. So let me say any types.
Yes. So there are types.
There are types.
There are two main types of asthma, and they are what we call allergic type, and then non-allergic type. So the allergic type is those that are associated with allergies.
Allergies.
Yes. So allergy is simply an abnormal reaction of the immune system. The immune system is like the police of our bodies. They are supposed to, it's supposed to protect the body against diseases. But unfortunately, in asthma, even when the immune system has not been provoked, it goes on the attack. And that attack is directed at the airway and other parts of the body.
And I would love to see the airway, what it really is, so that you can.
Yeah, so I think if you can project the picture,
the image of the airway.
What is unfortunate is that we only see the outside of our bodies, but we don't know what is inside.
Yes, we don't know what is inside.
So basically, that's a very nice picture of the airway. So as you can see in the picture, you see 3 tubes.
Yeah.
The one to my left is how a normal airway looks like. So this airway you see there is a tube that is down our necks. That as we breathe, air passes through, enters our lungs, and then when the lungs are taking the oxygen out of the air, it releases, what is left, and then it comes out. And then we take in again, and then on and on. So on the left side, you see how a person who doesn't have asthma's airway looks like. You can see that.
Hey, nothing.
A coin dim. It is when the person is breathing, the air goes in and out freely. But the one in the middle shows what happens when a person has asthma. You can see that the wall of the airway becomes thick. And the passage in it becomes narrow. And unfortunately, this happens because the immune system, which is supposed to protect us, rather attacks the airway. So the airway is always thick, and the passage through it is
immune
narrow.
System na I was saying
boy and bino.
Oh, okay.
So that's the problem with asthma. And unfortunately, when somebody has asthma, that's how the airway is all the time, the one in the middle. But from time to time, the airway becomes even thicker and narrower, and that is what is shown on the last one. So it is during that time or that episode that a person gets what we call the asthma attack. The person is unable to breathe, he struggles to breathe. When he's breathing, it makes noise, the person coughs, the chest becomes tight. So that is what we call asthma attack.
That is what you saw. The last one means the person has an attack.
Yes.
But the second one, the middle one, means
that is the normal asthma patient. So that means that for the asthma patient, he or she always has a problem with the airway. And that is what we have to understand, that there are 2 aspects to asthma. One is the airway, like in the middle, which is always thick. And the second is the airway, which becomes very narrow and gives you symptoms.
Oh, okay. And always sick in there. You are just there. It's just part
always
of you.
like that, yes.
It's just part of you. But
it's always like that.
Other one tells you that you have an attack.
When it becomes critically narrow.
When it becomes critically
then you have the symptoms.
Okay. But what causes the attack? Yeah,
very good question. So the attack would happen in somebody who already has asthma. So for some people, they can't point to anything that causes the attack. they are just there and the attack happens. For some people also, they have clear triggers. Some people, in my experience, there are two main things that trigger the attacks. Those are exposure to dust and perfume. So for most of the people I know, or the people I see, the main triggers are dust and perfume.
Dust and perfume.
Yes.
That's the main triggers, but the rest. So
there are some like certain foods. Some people will eat groundnuts and get attacked. Some people will eat rice. And also cockroach allergens. You know, when there are cockroaches in the house, there are particles that come out of cockroach. So there's even been research in Ghana that shows that the more cockroach particles are in a person's environment, the more likely that person will have asthma attacks.
Now, asthma, is it acquired or is inherited?
It's both. For some individuals, it is purely acquired. The airway comes under the attack of the immune system without any genetic predisposition. But for some people, it is inherited. But the inheritance is usually not a matter of course. Say, once your family, a family member has it, you're also going to have it. You need, it's usually an interaction between the inheritance, or let me say the genetics, and the environment. So if you have the genetic predisposition, and then you have a suitable environment, then
and you're not combo.
And unfortunately, when it comes to the environment, many diseases are caused by dirty environment. But the opposite happens in asthma. In asthma, for you to get to become to have asthma, it is rather cleaner environments. That's why you said early on that there is Sikafoyari. Because Sikafoy the environment so they tend to have it. But the unfortunate thing is that when you get it, then dirty environment rather gives you the symptoms. Yes.
And they acquired. Does it happen during birth or pregnancy, or there's something that probably the person did?
Not exactly during birth or something that the person did. Sometimes it's unexplainable. You can't really tell what went wrong. So there is no particular thing that really one can point to. Say, this person did or that, did this or that, and that's what resulted in asthma. Or if one does A, B, C, or D, he or she will get asthma. There's nothing really like that.
You can get interactive with us on 020-439-1417. You can send your WhatsApp messages. But your WhatsApp line, Memfrey. Your baby phone lines need later. No video call, no WhatsApp call. So send only messages to 020-439-1417. Doc, and then kwadatna, and then paying for tna, and is there any treatment options available for asthma?
Yes. Unfortunately, asthma, it's not curable. It is a bad very unfortunately. But obiane nedi, obi homa a sha sifi ninkola bremo. And with time, it becomes quiet. It doesn't mean that it's gone. It is there, but it just doesn't show itself. But for some people, it starts from childhood or adulthood, and then it worries them throughout. And you know, the main thing is that asthma is not curable. Unfortunately, some people think that it can be cured, or it goes away. It doesn't quite. It may at best become quiet.
Doc, me no, but in painful. No.
Yes.
Like I had people who were saying that they treated them with herbal medicine with fear. Me ba we there. Me man herbal. Me ba we in there no na anko.
And only problem no. Because nipa bebree from asthma. And many of them, the fact is that there were people who were not having symptoms at all. And one day the disease struck and it was out of hand. It could not be dealt with. In fact, 60%, about 20% of people who die from asthma, they were not having symptoms at all. It was as if the sickness
Just
Out
all
of
of a
the blue.
sudden.
In fact, in my experience as a doctor, almost every person I've seen die from asthma, they were not having symptoms for years.
Wow.
It struck all of a sudden. One particular lady died before arrival at the hospital. And for some others, they came to the hospital. We did whatever we could, but we couldn't save them. So, asthma really is not curable, but it can be controlled. In fact, you can treat it so well, say, you will live as if you don't really have asthma. And that's where the problem is. Because the major problem with asthma is that it is not well treated.
It is not well treated.
At all. Many people, when they have asthma and the symptoms come, they go to drugstores and get tablets, one tablet or the other. But tablets are not good for the treatment of asthma. Or some people also use a very popular inhaler that is called salbutamol inhaler.
Yeah.
Salbutamol has been found to be a major cause of asthma deaths.
Wow.
Yes, because there are two main treatments for asthma. One group of treatments only help you to breathe better when you have an attack, but they don't treat the underlying illness. Picture no more. There are a second group of inhalers. We call them controllers. They deal with the underlying problems, and they are the main treatments for asthma. And it's unfortunate that most people who have asthma are never given that treatment. And not using that treatment is the main cause of asthma deaths.
And because when you say cough-baby, a pharmacy, and Kagana, we hardly go to the hospital.
Sir.
We don't see it very needful. So we walk into the pharmacy and then we buy tabs and we buy anything that we feel. But say treatment option be available. Maybe say me will be what me want offer on you use Seritide. It's BB say no. Or no. Then no bit because we use Seritide and Sabutamol.
Very good. Sena make in drone two types, relievers and controllers. In the drobit it says Seritide, a controller, a major drug for treating asthma. And then Obio use Seritide no regularly no.
Yeah.
Sena make yare no near was no, they be a neo. The drug has to be taken near from controllers is a Seritide. They have to be taken every day. Every day. Until, say, a person is so well controlled, say, Dr. Becker said, no, we notice so. We use no morning and evening, once a day. The friend will step down. And I said, Dr. Betty, monitored in Yapakona, a year or so, no one attack, no, I can't say what they're to Boasi. If you do not to Hana. And Tisai Drono, they are very important, but they also be who senior, you used to know. Asthma drugs, most of the best of them are inhalers. So when you attack, that's all about before tablet. Time attack no air how no. I feel that tablets near call him. We could do a saka it gets absorbed into the bloodstream and then get to the airway where the disease is. Before I realize it may be too late. But if you use the inhalers,
it's faster.
They get to where the disease is immediately. So the main treatments for asthma are inhalers. And the main treatment, since last year, 2019, the global body that deals with asthma management changed the way asthma is treated.
Wow.
And for now, there's a particular drug, I refer to formoterol based controllers. Controllers normally controllers, the best of them, they contain two drugs. But near formoterol woman, it is a Symbicort. They are now the preferred drugs for treating asthma. Because I don't know who or no it may use when you have an attack and also as a daily treatment. It's only both a reliever and then a controller. And now, if you might just say, approach is what reduces asthma deaths and the problems with asthma. As a country, say in Ghana, no people will be ruled from asthma. Asthma it causes more deaths than COVID is doing now. In 2017, we lost, according to WHO, 1,704 people in this country, Ghana, from asthma.
Asthma.
That means that
only asthma.
Only asthma. That means that 4 to 5 people die from asthma a day in this country. And we know that about 65% of people who die from asthma, they die before they get to hospital.
Okay.
Into the main treatment is for the person who has asthma to have the controller medicine, Seretide, Symbicort. And they should use it daily. But one major problem with the use of the inhalers, any inhaler technique. Inhalers, no, you design them in such a way that we use so dose now, you state say a woman. That is what is supposed to get into your airway and work.
Yeah.
But whether that stated dose no will get to your airway depends on how you use it. If your technique is bad, it may not get to your airway at all, or just a tiny fraction of it will get to the airway. Until recently, I was taking care of a health worker. I was not a prescriber. I mean, he has had asthma for quite some time. He uses Symbicort. And normally, if you are my patient, I'll always ask you to show me how you use your inhaler. So I asked him to show me how he uses the inhaler. And to my surprise, he opens the inhaler and closes it before he inhales. So somebody like that, he was not getting the drug delivered to the airway at all. Ideally, the best way to use the inhalers, there are 5 steps. Step number 1, you get it ready. It is a Seretide and a Symbicort. There's a way I will be. Will be that step number 1. Step number 2, when we say Yankukuno already know inflammation homa. Ne draw is here inflama. Intino say inflama ewo kukuna sa oba behumia. It is any tie I am an opesa or pump inflama nenko.
Yeah.
Intino what you do is first of all to breathe out. And when your chest is empty, after you've breathed out, so you put the inhaler, you exhale maximally. Then you put the device to your mouth and then use a bit of force to inhale it. Then when you inhale it, you don't breathe out immediately. That's what most people do. When you breathe out immediately, everything you inhale comes out. So you have to hold your breath for about 10 seconds. When you hold your breath for 10 seconds,
this is training.
About 80% of the drug will get delivered to the airway. In fact, it is known that if you hold your breath for even less than 10 seconds, the amount of the drug that will be delivered to your airway is so small that it will not work. Let alone not holding your breath at all. In the asthma treatment, it requires a lot of training. As I said, so many people die before they even get hospital. So the key to treating asthma is to make sure that that person who has asthma knows how to treat it himself or herself. Because time and yamin pengo benya attack ebekuno. No, be a doctor be anyone a baby and to one also who say, oh, we know semi suicide drawaway in the case of attack. I'll say this is how my technique should be. So you soon as a year now I rush to hospital.
Doc, whilst speaking, you made a point that there are some who don't even show symptoms at all for a while. But you hold on to that point. We'll go for a quick commercial break. We'll be right back. If you just joined us, this is Facts of Health. We are live on ATV. We are streaming live on Facebook. You can search ATV Ghana and then search Facts of Health. You get to watch us. You can also follow us on all our social media handles: Facebook Facts of Health, Instagram facts.of.health, Twitter at Facts of Health 1, and then subscribe to our YouTube channel Facts of Health. You can join the show through WhatsApp messages 020 439 1417 020 439 1417. We'll open the phone lines later on so that you can get interactive with Dr. Steele. We are talking about asthma. Doc, before we went for the break, I asked whether there are some, you said you don't determine, they don't show symptoms at all.
Yes.
Then all of a sudden, boom.
Yeah.
It happens.
Yes.
So how do you determine that you have asthma and then you have to take care of yourself?
Okay, so basically asthma has 4 symptoms. Number 1 is shortness of breath. So a person from time to time struggles to breathe. Number 2 is what we call wheezing.
Okay.
You breathe and it's as if your breath is you whistle with your breath. You hear whee, whee, whee with your breathing. Number 3 is that from time to time you feel that your chest is tight. You are breathing and you feel that the chest, I mean, it's tightening.
What breath?
Okay. And then the 4th one is cough. Cough. So these are the 4 main symptoms of asthma. People have it to different extents. Some people, in fact, I've seen people who have only cough. They cough and cough and cough and cough and cough. And nobody knows what happened. I mean, what is wrong with them. They treat it. It doesn't go.
Chronic cough.
That could be, then they'll have shortness of breath, but it's mostly cough. We call it cough variant asthma.
Okay.
And see, that is also one. So when you have some of these things, it's good to go to hospital and let a doctor see you. The other thing is that in many cases, asthma comes with other allergies, like what people call cold.
Yeah.
So all the time, this person has catarrh. You know, it is not cold.
Hey.
It is what we call allergic rhinitis. So some of those people, very early in the morning, you hear them sneezing on and on. Also, some people have very itchy eyes from time to time. So these conditions, if a person has the symptoms that look like asthma, and they also have the frequent catarrh and the itchy eyes, it makes it likely that it's asthma we are dealing with.
So the person is prone to it, or it makes.
But the person has asthma.
The person has
asthma. And when the person has asthma, it's important to go to hospital for a doctor to assess the person and then make a diagnosis.
Okay. Yes. You mentioned allergic asthma. You didn't mention that one.
Yeah, so the other one is non-allergic asthma. Allergic asthma is asthma that comes, or when a person has, usually it starts in childhood, early childhood, the people have it. And then they also have this frequent catarrh, which sometimes is triggered by dust and perfume. They may also have itchy eyes. That is the allergic asthma. And this kind of asthma, quite often, the attacks come on when a person is exposed to dust or some other allergens. But there is a non-allergic type which usually starts in adulthood. For some people have asthma from when they are over 65.
Hey.
Yes.
From 65, I feel
okay. Those types, they tend not to have the other allergies. So you cannot clearly point to something that triggers the asthma. Apart from that, they don't often have the catarrh, the frequent catarrh, what we call the allergic rhinitis. They don't also have, or often have the eye symptoms, the itchy eye symptoms. So those are the main types. But the other types like asthma, which has gone on for a long time, and because of that, the airway that I showed you has become permanently fixed. So it's almost impossible to reverse it. And we call it asthma with fixed airflow limitation. And then there's also asthma in people who are obese. Obesity makes asthma worse and more difficult to treat. So asthma with obesity is another type. And also asthma that starts in adulthood is also a different type of asthma. People have it beyond 18. That asthma
beyond 18?
18, that's what we call adult onset asthma.
Adult onset?
Onset asthma. It could be allergic or non-allergic, but they tend to be more stubborn to treatment.
Oh, okay, okay. Now, most of the things you are mentioning is just like COVID.
That's the thing.
It's just like COVID.
Yes.
So in this COVID era,
I
am wondering if asthma patients, they come to the clinic.
Well, I'm sure they do. They do come because they still have attacks. They still have the same problems.
COVID.
In fact, if you have attack, you're an asthma patient, do not avoid hospital because of fear that you might be labeled a COVID patient and then have to go through the uncomfortable isolation and all that. You have to come. And It's not easy. I mean, sometimes it's not straightforward to distinguish between asthma and COVID. It's very possible for somebody who has asthma to have COVID, and the symptoms become difficult to distinguish. And also, because of COVID, these days the asthma treatment has changed a little bit. In the past, when somebody had asthma attack, we would quickly put the patient on a nebulizer. These days, we tend not to do that because, I mean, I'm sure a big hospital will see a number of asthma patients per day. So if you are going to put everybody on a nebulizer, the chances of transmitting the COVID is quite high. So what we tend to use is what we call a spacer. The spacer is a small container that you can fit the inhalers into, and then you pump the inhaler into, put the other end at the patient's nose, and the person breathes in. And you know, that is the preferred way of treating asthma attacks now. But asthma and COVID can be a bit challenging to distinguish. But basically, if somebody is known to have asthma and the person comes with an attack, it's likely to be asthma and has to be treated as such. If I mean, somebody who is not known to have asthma has those symptoms, I mean, one can
now obi on asthma,
suspect asthma.
COVID.
Yes.
Survive it.
Oh yes. And asthma itself doesn't make a person get COVID more. But when a person has asthma and he or she gets COVID, it makes it more likely that the COVID will be severe. And that is why in these times, people who have asthma should treat themselves very well so that they don't get attacks in the first place by being on controller medicines and using them well. Yes.
Before you be reassured, no, but using well,
Metro,
are there any other related complications to asthma?
Yes, so one of the main complications is when a person who has asthma does not treat it with controller medicines until it gets to a point where the person develops what we call fixed airway limitation. That is what I mentioned earlier. So in that case, the airway is usually made up of smooth muscles. But the airway, when asthma is not treated with controller medicines, rather has scar tissue. Scar. Just like when you get a sore, you get scars. So the scar tissue may take over the airway. And when scar tissue takes over the airway becomes very difficult to, open up in case of attack. So that is a major complication of asthma.
That's the only complication they have?
No, that is only one of them. Some of them can go into what we call respiratory failure during attacks. Respiratory failure, and that means that the asthma has damaged or affected the airway so much that that person cannot breathe on his or her own. So he needs machines. And unfortunately in Ghana we are very limited in these sophisticated machines like ventilators. It can be a problem. Yes.
Okay. We have some few messages. I'll take that and then I'll do mine. So hey, message in the Tintin doc. Hi, good evening. My favorite host and auntie, you're looking lovely and beautiful as always. Thank you. As well as Dr. Dazi, thanks for coming. Okay.
Thank you.
Okay, so me can you say just me what are the asthma triggers? And then how can I make my lungs stronger even though I have asthma? How does asthma weaken How does asthma weaken your immune system? Can asthma be cured, Dr. Abosho Dada? How to tell if I have asthma and any determination
Okay.
Then differences between asthma and anxiety attack.
Wow.
And we are very, very I like the question there.
Yes. So basically, as I said earlier, the main triggers of asthma, from my experience in this country, are dust and perfume. But the other ones, like, pollen, I have asthma too. I mean, very mild asthma. Normally, when I go to forest areas, I can't handle it. So when I go to forest areas, like Eastern region, I remember some time ago I had to do a program at Akwitia. So when I got there, every morning I had symptoms of the asthma. So forest area, because of the high concentration of pollen in the air. So pollen is a major issue. Some people also they can't tolerate certain foods, mostly groundnuts, eggs. It doesn't mean that if a person has asthma, he shouldn't eat groundnuts or eggs. If in a particular asthma patient, groundnuts doesn't cause a problem, it doesn't mean that he or she should abstain from groundnuts or eggs or milk or whatever. So those are some of the few triggers. Between asthma and anxiety is mainly underlined by fear. But a person who has anxiety, you realize, normally, the time the symptoms started is around the time he or she has some fears. But asthma patients could be having symptoms over a long period of time. And normally, anxiety will not give you things like cough. It will not give you catarrh, the eye symptoms. Asthma will.
Okay. How often should one use his oil inhaler, the Ventolin inhaler, and the preventer? Okay, so please, does herbal medicine cure asthma? Hi, I'm Atakura Aminiampong from Kumasi. My question is, where can I find the doctor? Or please, can I get his contact? Where do I get to buy the medicine? I have kids who have asthma. Please, what is the treatment for kids? My husband is asthmatic. Can I please get the doctor's now? My viewers, so let me continue. Hello, please. This is Ivy. I was in SHS one day when I couldn't breathe well. I was sent to the hospital and I was told I had asthma. That was the first time I had that attack, so I was surprised. Oxygen was placed on me, and from there I usually can't breathe well, sometimes because of dust and perfume. I was also told not to sleep under fan.
Oh, well, not to sleep under fan is not quite any issue. So it depends on the individual. If he or she can tolerate fan, you can enjoy being under a fan. See, the thing about asthma is to make sure you treat it so well that you can live a normal life. If you cannot tolerate things like fan, exercise, it tells you that the asthma is not being treated well. So you need to get it treated well. Yes.
I want to know if it's truly asthma, because I sometimes don't believe I have it. A friend told me to take Asthmanol, so that's what I always take when I find it difficult.
No, those are the drugs people should not take. Those drugs are some of the reasons why we have a lot of deaths from asthma. As I said, asthma affects your airway. If you are taking a tablet to relieve you of asthma symptoms, if it is critical, before the tablet gets to where the disease is, if the unfortunate will happen, it would have happened. So the best treatments are the inhalers. And the main treatment is not even salbutamol inhaler, but the controllers, the Symbicort, the Seretide, and some others, beclometasone and others. Those are the drugs that people should be on. Somebody asked a question about children.
For children, yeah.
Yes. Children usually under 6, so 5 years and younger. That's where the problem is, because they cannot use the inhalers directly. So there's a device which I mentioned earlier called the spacer. The spacer is available in some of our pharmacies. Normally it has 2 ends. One end can admit the inhaler. So you put an inhaler there, and if a child has an attack, you pump about 6. Do about 6, or let's say, about 6 puffs into it, and put the end which has the face mask on the child's nose and let the child breathe it in and out for about 3 minutes. And the spacer is just as effective as the nebulizer we use in hospitals.
Okay.
So a child must use the spacer. And also, the child has to be on a controller medicine. The children have, there are controller medicines that are like that can be pumped into the spacer. So daily, when the child is going to sleep, or morning and evening, you can pump some into the spacer, put it at the child's nose, let the child breathe it in and out for about 3 minutes, and then the child goes to sleep. When a child is treated that way, usually they don't have problems. They can play, they can exercise, they can do anything, just like everybody else.
Doc, may baby be a phone license, but I bet taking messages, they are taking phone license, and see a bit tracy kaka. So you can call 050-815-6857, and then you ask Doc your questions about asthma. 050-815-6857. Mr. Ofra, lower TV set, no. Men tell me what TV no so, tell me what phone no so. Why, Mr. Pa? Doc, Doc, a year no that I was say asthma no jaifa. So you have to see a physician, isn't it? So
yes.
She's well
let me say, sir, unfortunately, what happens in our hospital, which is so unfortunate, is that when people go to our hospitals with asthma attack, all what the doctors and the healthcare providers do, they just nebulize the person and put the person on prednisolone. That is not acceptable. That person, first of all, has to be made to come regularly for reviews. The person has to be on controller medication. Giving somebody nebulizer and prednisolone alone is not good enough treatment.
Also, mine starts, I have really a very serious, I really had a serious attack, and then I've seen other asthma patients too who have. Mine usually starts with cold and I can't breathe well. I also hear the whistle sound. I really need help. Okay.
So such a person needs to be treated properly. What she said, the cold is what I said, allergic rhinitis. It has to be treated, because when people have that condition on its own can trigger the asthma. So usually there are some sprays, some nasal sprays that can bring them under control. Yes.
I also want to know if being under, Doc, under fan, no, or some, then a question. Good evening, Doc. Please, what happens when a person is under an attack and needs the inhaler immediately?
Yes.
Is it possible for the person to breathe out before inhaling the medicine? If yes, how? Hello, Doc.
Hello.
Hello, good evening.
Good evening.
What's your name and where are you calling from, please? Okay, Naomi Kodo, I. Okay. On COVID-19, won't you in hospital by asthma? Yo, Mate, Doc, be you one.
Me, you are called a book polyclinic. Auntie Seba, once a back a boom.
No, Doc, no outside that crowd.
One is obey us.
It's no channel, no remedy.
It's although hospital. Most of the time, say hospital, never catch a doctor do asthma. About sure, come on. Or that doctor knew. A do now for no controller. No.
Doctor Patrol. Hello. Hello. Good evening.
Hello.
Hello. Good evening. Patrol. Hello. Okay.
Hello.
Hello.
Good evening.
Good evening. Please lower the volume of your TV set.
Your problem.
Okay.
Hello.
Yes, which cause me why? Odo.
Mr. Renopa, me 2 cents this is now. Me the coffee fancy. I don't understand what that is. The sign of asthma or.
Okay. Doc, may you want to know why? Doc, let me add some messages and then. Please, the way the doctor is explaining the asthma, even me cry, I'm understand. That's good. My name is Ebo. Kudos. Hello. Hello. Good evening.
Good evening.
What's your name and where are you calling from?
Please, I'm calling from Matai Kotema. My name is Abigail.
All right, Abigail Kodrai.
Please, I want to find out why my husband always have an attack around 11 p.m. at night. He has been to the hospital and they prescribe drugs for him, but still, he always have difficulty breathing.
All right.
Always at night. Please, so doctor.
Okay.
Please help me with my question.
All right. Doc will help you.
So first of all, let me address the question of the lady who always has the cold or the catarrh. It is not necessarily asthma.
Hello.
Hello.
Good evening.
Hello.
Good evening. What's your name and where are you calling from?
Your friend is Christine. Free mile 7.
All right, Christine Pocho Kodrai.
Semi sorry, I'm not partner. I will mount a family. Mary, sister, no, my
Okay.
If you let me ask what's why I just a no asthma drink and then I told me. If you let this, I say, sign of asthma, and I got to asthma. Now, if you may think a crazy now, but this over the whole to me when I cry, just your man, one of the man asthma drain and so it's me. After me. What you mean, you may think cry.
Yo.
Last year, super and you so weird. Honestly, the same asthma. But on the no machines are about me apply, but all apply now one that's all them.
Okay.
If the person this doctor say, maybe the enemy brand and you're there now from because I want to say it's true.
Yo, me that's a part Christy.
Sa yarena Emma Nipa Ehwenti anopano. Sena meka ina yarebi a friend allergic asthma, allergic rhinitis.
Yeah.
Eno na kasa nye asthma. But any asthma na enam. Obi wo ma ne yare na eyo no nko a. Obi wo mo sa owo no any asthma no. Sa yare no the treatment.
Last one.
Okay.
Hello.
Good evening.
Good evening. Mpacho nyame adomo. Eye na unso e.
Boko.
Ye de nyame ase.
Thank you.
Hello. Hello, Mpacho line mu nya clear crowd. All right, Kojo. Also.
But you more asthmatic patients that make it 33 years. You can't say, but I do benefit at the time with my fasting. You can because quite now is not before casting me before you have almost really
Doc, what's your name?
Minty.
Okay. Yo, yeah, that's it. No, I say we did 33, but I said no, Swano. Unya. Odi for some years now, unya ye. Or besides, say, Kwana say, if you to me up, I say, or benya attack on the Namasa and maybe I will be pain. So I'll add some few messages. Okay, so can asthma cause the heart to enlarge and fail? Hello doc, please, my boy is 14 months old and frequently have itchy eye and cold, especially at night. The cold comes even if he didn't sleep under fan or AC for long. Is it a symptom of asthma? Hi doc, my husband always have an attack at, I think she was the one who called, late at night. Doc, feno kakana
you know, sa when no any nekeka no any asthma na but omo shut down here asthma. It is obi we no bia na duro ho e we duro bi o ma efe no intranasal corticosteroids spray. We spray go hwenu mu a daily a the mass symptoms no be from. IHS no so and also one nedro. There was some special eye drops beer. It me Emma and no be from. Now your sister no say no kuno enya attack every night no. Most likely treatment no your problem.
Okay.
Most of the time no omo what's our problem. Omo use so a drug anu enyenam to say a salbutamol inhaler any tablets we the best treatment also munya a drug is a Symbicort Seretide and on a drug you treat yes.
Then the one
but apart from that Mr. also making sure say asthma sometimes there are conditions which is say heart failure it is a high blood pressure no so no how many had sir but my saying here asthma there also call hospitals now doctor shena what me diagnose exactly what illness it is.
Now mama no afraid or say ninua ewu efim ne ba obi ono so obi eye ba no omafa
very important say American the same problem obi one more machine wo fi ba edru ofa or the machine fa ni salbutamol say American no we depend on salbutamol nko a enya de bebo we here inhalers are from controllers no so when you use controller you are not really treating the asthma well. I know the man who will be from asthma no. But from my experience no obia o use sa controller no na o use no yie no the technique no ya kama no o to me it's not free from symptoms.
Okay. Okay. Obi bisa say, how do you deliver Symbicort through a spacer? Okay, then also my wife takes asthma to reduce her attacks in the night. Most often, is it okay? Please, my name is Jacob. Hello, host. Please, I've been sneezing sometimes in early morning and then at dawn. And I always sneeze continuously when I come across dust. My eyes has been itchy always. What should I do? Please, what do you do if you find yourself with an asthma person who is having the experience without his inhaler? Very important question. And when you get the inhaler, how do you administer it as first aid?
Very good. In the same American, Obi besides say who Symbicort, how do you use it to the spacer? Unfortunately, asthma inhalers no, they buy in two types. You want to to pressurized metered dose inhaler and no pump and no can obey me use with the spacer. The other type no, you from dry powder inhalers. I don't know what you direct. Won't mean you see with the spacer. It is a non quan or won't mean you see with the spacer. But there are other controllers to say beclometer zone. I don't know bar in the pump form no. To bet me you see with the spacer. I don't know yet better for children.
I know you're better for children. No baby say ushia obi no wenya attack. Oni ne ebi awon sa so inhaler no mo. First aid will be anything.
It is a inhaler no. The first thing you have to do ne say obe shake inhaler no. Na man nipa ko na bie nenum. Obetumi ahome a onhome mpie, but sometimes no during attack no say obe home mpie na yedin. It's in that case no obe pompe inhaler no. Maybe one after the other, at least 2 to 4 times. Then if I call now, sir. After that, no better train. After 20 minutes, send if I call no home, yeah, you pump again. Over every 20 minutes, copy him timer. If I call no better no. If after the 4th time, if I call no so no, yeah, you have to send the person to hospital.
To the hospital.
Everybody who has an attack should at least go to a hospital. Even if he's able to deal with the attack.
I think there's one important message I skipped, but time is about. Let you take just 1 minute to fail. Or say a bit to me lead to heart failure and heart enlargement.
That be heart failure no, and also what symptoms be a year any asthma initial. To say difficulty in breathing, especially at night. But asthma aim to me heart failure. I did cause heart failure, high blood pressure.
Okay. Okay. Doc, thank you so much. Thank you so much. And then you share the that's it. Doc said, "Mo bet me about very friend well. Kolebu Polyclinic. Doc, what they be our own."
Now, say I'm here into me on Wednesdays. But me can't say me so because I'm sure you're any papa before. You know.
So they can come to the asthma clinic in polyclinic.
They should come on Wednesdays and ask for the doctor who runs the asthma clinic.
All right.
Yes.
All right. You can always follow us on all our social media handles: Facebook, Facts of Health; Instagram, facts.of.health; Twitter @factsofhealth1, and then subscribe to our YouTube channel, Facts of Health. My costume, beautifully done by Miss Foley. You can call Miss Foley on 0544539655. You can also get Pina for my hair and makeup on 0541832737. You can also get Baker's Hub on 0245203864, and then Nail Touch on 0274235205. Thank you so much for watching. I'm Na Edu. Same time next week.